There is this misconception that I've gotten it from series of men that if someone performs a prostate surgery, that such person's ability to have sex will be lost. In other words, that the person will not be able to have erection again. Please, I'm here to bust this myth because this attitude or this thing has made a lot of people not to seek proper medical care on time, on the ground that if he or she finally visit the hospital, that once the prostate is removed, that such an individual will not be able to have erection again. Please, this is a false assumptions because there are some men, I've count not one, not two, who has undergone this surgery and has testified that they are having erection. Please, if you are noticing any sign of prostate issue on yourself or on your loved ones or your parent, please, adequate seeking of medical attention is needed, because if the prostate is left unmanaged, it can cause series of health consequences. This prostate is seated on the neck of the bladder, and once they are enlarged, they will block the flow of urine from this bladder down to the urethra. And once this prostate has been enlarged, it will cause blockage of the flow of urine from the bladder. And once the urine is accumulated in the bladder, we all know how urine smells when it stays for a very long time. And once it is accumulated, it will now become infected. Once it's infected, it will now start attacking this bladder, and if emergency care is not taken on time, it will migrate and enter into the kidney and cause this series of kidney damage. Even urinary tract infection is not left out. Please, once you notice any prostate issue, pay a visit to your urologist so that he will take adequate care of you, because there are some prostate that doesn't require surgery, that you need only drugs. Like if the problem is from the neck of the urethra, this drug will help to relax the muscles of this urethra so as to allow urine to pass through. And also there are some certain drugs that will stop the progression, the enlargement of this prostate. Please, it's not all prostate issues that require surgery, and prostate is not curable. The only solution, the only last resort for prostate is surgery. And this surgery, once it is done, depending on the level of depending on the age of such an individual, there are some people that has faster recovery rate, unlike the people that has lower recovery rate. Those people that has faster recovery rate is dependent on your age. The younger, the faster the recovery, and also the older, the slower the recovery rate. And this recovery rate is also dependent on your pre-morbid personality. It's dependent on your past health or your present health conditions. Like there are some people that are diabetic, that are hypertensive, that also has various series of cardiovascular problems and other diseases. You will notice that the rate of your recovery will be slower, unlike those people who doesn't have any health issues. And this prostate, that they say that once you do a prostate surgery that your erection will be affected, is not true. There are some warning signs that will alert you to know that this person is having a prostate issues. If you see yourself having difficulty in urinating, or that you have urgency in maturation, or that you might be noticing some dribbling of urine, please seek a emergency visit to your urologist so that he will assess you properly and know the type of treatment that is required of you. Prostate affects all men, provided that you're a man from birth. All men from birth has a prostate gland. As one advances in age, if you are a man or an elderly man between the ages of 55 to 69 years, please, you are encouraged to have prostate screening at least every year. This will now help to know when the prostate is in bad condition, and also if you have a history, or that your parents or your siblings, or you have a familiar history of prostate cancer, you are advised to start your prostate screening at least from 40 years of age. In other words, all men should start their prostate screening at 40 years of age to avoid the prostate progressing into cancer. Especially if you have a family history of cancer, you are advised to start your prostate screening at the age of 40.